Did you know over 13,000 people die from pancreatic cancer each month? Often because early symptoms are overlooked. Subtle warning signs such as a slight jaundice or a mild abdominal discomfort go unnoticed, delaying diagnosis until advanced stages. Today, we reveal 5 shocking symptoms of pancreatic cancer you must recognize early. Pancreatic cancer develops when ductal cells acquire mutation and a dry uncontrolled proliferation and invasion of apoptosis. Its deep neuroperitoneal location and non-specific early manifestations hinder detection, contributing to a 5-year survival below 12%. Research indicates biomarkers and risk factors clustering may improve early diagnosis, underscoring the need for heightened symptoms awareness, advance in imaging modalities, and a liquid biopsies after promise. Before diving into 5 shocking symptoms, consider the subtle early alerts your body may be sounding. Chronic fatigue, unexplained itching, and pale skin can precede more dramatic signs. These low-grade clues often escape attention, masking underlying blurry abstraction or systemic inflammation triggered by pancreatic tumors. A slight change in stool size or frequency, intermediate nausea after meals, nuanced indigestion can be the body's direct cry for help. Recognizing these silent bills allow you to seek evaluation sooner, catching disease while it is still actionable. Stay tuned to this whisper. They could absolutely save your precious life today. Yellowing of the skin and sclerola without itching is often the first subtle signs, but detectable sign of a bile duct obstruction by mass, and its silent progression delays clinical attention. This occurs in around 70% of patients at initial presentation. A tumor in the pancreatic head can compress the distal common bile duct, leading to elevated bilirubin levels and a cholestasis detectable by a non-invasive imaging modalities and liver function tests. If you notice an unexplained jaundice or a scleral yellowing, schedule an abdominal ultrasound on an MRCP promptly with your physician. Detection of early stages tumors amenable to surgical resection dramatically improve 5-year survival rates. Possible pancreatic exocrine insufficiency and cachexia, often preceding other symptoms. Tumor-induced proteolysis and lipolysis elevate inflammatory cytokines, driving muscle wasting and adipose breakdown, which clinicians detect via elevated C-reactive protein and a low albumin. Track your weight daily. Report any unexplained loss over 2 kg in a month. Early nutritional intervention and imaging can uncover tumor before metastasis. Sudden development of a type 2 diabetes in adult over 50 without family history can herald pancreatic dysfunction, as tumor impaired beta cell insulin secretion. Cancer cells secrete islet dysfunction factors and pro-inflammatory mediators that inhibit insulin release, elevating fasting glucose and HbA1c level, detectable in routine labs. If you are newly diabetic without typical risk factors, request pancreatic imaging, CT or endoscopic ultrasound, alongside your endocrinologist to rule out malignancy. Persistent, dull pain in the upper abdomen or the mid-back, often worse at night or when laying down, arises as tumors, invade retroperitoneal nerves. Malignant infiltration of a celiac plexus triggers neuropathic pain signals. MRI or endoscopic ultrasound can visualize preneural tumor spread correlating with the patient discomfort. Report now. Unexplained epigastric or back pain lasting more than 2 weeks. Early analogous plus diagnostic imaging can expedite tumor detection. Plastic pigment accumulate in the blood when bile flow is blocked, causing tea-colored urine and black-colored stools. An alarming pair often linked to pancreatic head tumors. Obstruction of bile excretion rises conjugated bilirubin renally excreted, while lack of acetobioligan turns stool pale. Both are seen on LFT panels and ultrasound. If you're in darkness and a stool laden with a dietary change, seek immediate evaluation. These are red flag signs, promoting ERCP and MRCP within days. Smoking. Carcinogens like nitrosamines induce KRAS mutation in the pancreatic epithelium, promoting tumorigenesis. Chronic pancreatitis. Repeated inflammation fosters DNA damage and fibrosis, creating a poor tumor microenvironment. Family history and genetics. Germline mutation in the BRCA2, PALB2 elevate lifetime risk by up to 10-fold. Quit smoking. How to enroll in a cessation programs. Use a nicotine replacement therapy and behavioral support. Anti-inflammatory diet. How to emphasize fruit, vegetables, and omega-3 fats. Limit red meat and processed foods. Maintain healthy weight. How to combine moderate exercise with a balanced caloric intake. Targeted BMI lower than 25. Early detection of a pancreatic cancer hinges on recognizing symptoms like a painless jaundice, weight loss, new diabetes, abdominal back pain, change in a urine or a stool color. If you experience any of these, act immediately. Consult your physician, request imaging, and don't delay. If this video helped you, like it, subscribe, and share. Always seek professional medical advice for diagnosis and treatment.